there is a lot of GH controversy lately with Andrew Huberman's statements and Coach Greg, and I just like to call it Doucette or Deuce because I knew a Deuce in college. But anyway, same exact last name. Nowhere near as smart as Doucette. And he was actually tall and thin, not short and jacked. But anyway, meatheads rule the world sometimes, and so do nerds. But nerdy meatheads definitely rule the world. But guys, listen, Huberman, he is a genius, right? Nobody's going to contend with that guy. But he's giving out information in a manner when it comes to performance that is a little bit misleading. And this is why. Growth hormone at a standard basal level in a healthy male is 5 nanograms. That's 5 billionths of a gram per milliliter, ml, per ml. That's a standard. That's a standard in human beings, human men. That means when you're walking around during the day, what you have trickling, whether you're working in your office, walking lunch, doing whatever, except for working out because you'll get a little blip. By the way, if you stub your toe, you get a blip. If you put ice down your balls, you'll get a blip of GH. I mean, literally, you will. You know why? Because GH is stimulated at a tiny level. When I'm talking tiny, I'm talking below levels of nanograms. Below levels of nanograms per milliliter. Inconsequential amounts. But if you could see it, it would look like that. Where significance for performance, we'll talk in more quantitative terms in a minute, but would be up here. So qualitatively, yeah, statistically significant. If you got nothing and you go to 1, that's a 100% increase. If you got 1 and you go to 2, that's a 200% increase, right? If you go to 2 and you go to 4, that's another 100% increase. It's a doubling. It's a doubling of the actual amount that you have. That's statistically significant. But is it empirically evident? Is it relative? Does it do anything? 5 nanograms per milliliter times 1,000 will give you the nanograms per liter. That is in blood volume. That's what that is, in blood volume. It's made and comes from algorithms that medicine has used for decades. It's an algorithm that just basically shows how to dose anesthesia and parenteral medicines, medicines that basically you tap a vein, parenteral. So stuff that you do for surgeries, all the thousands of different types, any type of surgery, they need to be able to calculate anesthesia for that patient if they're going to put them out. And even if they're awake, a lot of the times they do a local and all this other stuff. So they got to calculate these blood volume problematic issues to a T. So they know this stuff. This is not my opinion. This is not Renee's opinion. But 75 milliliters per kilogram is the general volume per body weight that is calculated for an athletic male. That doesn't mean you're jacked even like myself at 5'8", 245, right? And reasonably lean, as you can see, right? But it's not Ronnie Coleman, but it's a fairly jacked, lean, athletic male. Whatever athletic means. To me, athletic means you got some muscle. It doesn't mean you're a bodybuilder, obviously, but it means you have some muscle and you look like an athlete. Like most athletes don't look like soft marshmallows, whether they're fat or not. They don't look like just, those people where there's no vein, no contour, no nothing. I've never understood that, but everybody's different, but sometimes you have a body like that. That's not the athlete body we're talking about. We're talking about a body that has a contour to it, kind of like your natural athletic person who has, relatively small joints, and you probably think they lift even if they don't. A lot of times, different ethnicities that are darker, like myself, I can say this, I'm Hispanic, I am Chinese, I'm a mixed mutt of special mixtures of crazy things, and I have lots of friends of different backgrounds, and a lot of times, guys, straight up, Latinos, blacks, what else? All different varieties of geographic peoples, they all have genetics that have contour to their bodies. So, that being said, this 2023 garbage, everybody starts out at a different reference point, but in the blood, it's 5 nanograms per milliliter. So that's 5,000, if we multiply by 1,000, because there's 1,000 milliliters in 1 liter. So we want the amount of GH, that is that 5 nanograms per milliliter in 1 liter of blood, so that we can then convert it and find out how much blood volume is in a person. Then we can figure out what statistically significant matters and means in terms of that number compared to the exact number empirically in the world, in your body right now, or what you need to do to inject in order to get the effect of something as simple as Rhonda Patrick saying, go in the sauna 2 hours a day and don't use your GH anymore and you're fine. She's awesome too in a lot of ways, but when it comes to performance, guys, like it's clear, like you just got to hear any conversation about anabolic steroids or androgens. And most of the time, to her credit, she'll say, I'm not sure about that. She'll say stuff like that, which I respect the heck out of. But you can't say in articles, this 6-fold, 8-fold, 16-fold folds, and Huberman too, as far as GH multipliers. Meaning, like we said before, if you have hardly anything and you double it, that's 100% increase, right? So that's what I'm getting at here. Let's do the math. 5 nanograms per milliliter times 1,000. Now you've got 5,000 nanograms per liter. The average human has about 5 to 6 liters of blood in their body. So if you take 6 liters, let's just take the bigger number, 6 liters. It depends on your body size. It depends on leanness. The athletic male reference I said before, that is the blood volume calculation for the volume of blood, the total. So we know how much GH, because we converted the units, is in a human male, a healthy human male, that is at basal levels, 5 nanograms per ml. I'm drilling this home, by the way, you can tell. I'm repeating this on purpose. 5 nanograms per ml times 1,000 mLs per liter. You got 5,000 nanograms per liter. You got 5,000 billionths of a gram per 1 liter of blood. 6 liters, we said we'd take the larger side. I mean, Shaquille O'Neal's probably going to have 8 or 9. But, I calculated mine. Mine is like almost 7, just because of the body mass. Ronnie Coleman's going to be larger. But 5 to 6 liters on average, right? That's probably going to nail anyone within 140-ish to 185-ish pounds. Maybe even a little higher than that. So, get that out of the way. 6 liters is our agreed upon number for the blood volume.